Good morning and welcome. Thanks for joining us for House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, back for more healthy conversation today. We're resuming our lives post-COVID. So we're calling this show Resume, Recover, Reconnect. I love the way that sounds. Resume, Recover, Reconnect. What a difference a year makes, right? We can finally discuss normal things like backyard barbecues and hugging family members, but we want to be safe about all of these things. So let's get an update from our guest expert. With me this morning is Dr. Helen Lavretsky, professor of psychiatry at the University of California in Los Angeles. Dr. Lavretsky, welcome. Thanks for joining us today.
Thank you so much for having me.
Absolutely. We're getting ready to jump into a very good conversation today. I'm excited about it. But before we do all of that, let's jump into our discussion with health in the headlines. Good health is always newsworthy. So each week we select a current headline that ties back to our topic at hand. We bring it back to our table and we ask our expert to respond. This week's entry comes to us from Healthline and it's titled 8 Tips for Coping with Reopening Anxiety When You're Living with a Chronic Condition. Dr. Lavretsky, can you share some of the thoughts and tips with us from this article?
Yes, so the article talks about the importance of listening to your body and dealing with your own anxiety in your own way, not being pressured by your peers, by your family to do risky things, and just slow down and relax into your own sense of what's possible, what you can deal with. And pace yourself while reintroducing yourself to the new normal.
Absolutely. That's so important that we listen to our bodies, know your body, and know when it's time to get some additional help. Let's get into our main segment to answer our viewer questions. We call this segment You Ask, We Answer. Doctor, it looks like so many people are dealing with that reopening anxiety that we just discussed. And there are so many questions in the queue. So let's dive right in. Our first question comes to us from Lucy in Tallahassee. Lucy says this: things in my state have opened up quickly. How do I manage my anxiety about knowing what the new rules are?
Yes, there's a lot of chaos, misinformation, and irrational fears. And you have to be, again, patient with what's unknown and with yourself, what you could tolerate, because nobody really knows what to expect, what might happen in the long run. At the same time, don't let your fears to get a hold of you. And create a system by which you function every day. Have tools that are available to your in your possession, so that you could use it when you're stressed. And normalize your life and your activities one by one. Ease yourself into the new life. Use summer months because it's all in open air to introduce new outdoor activities and allow yourself to feel comfortable with that. Ease yourself into your new normal.
I love that. Ease yourself into the new normal. That's good advice, doctor. Thank you for that. Kelly from Eugene, Oregon sent us this question. I live with social anxiety. What are the tips that you have for managing my anxiety while re-entering?
Right. It's very important to have personally accessible tools. For example, breath. Breathing is easy to use. Everybody breathes, and nobody notices when you do so. So if you just slow down and pay attention to how you inhale, follow the flow of air through your nostrils into your lungs, expand your diaphragm, expand your belly, and just listen to your body going in and out, in and out. I usually, when I deal with anxious patients, I prescribe slow breaths, conscious breaths, 4 to 6 breaths per minute. And that comes down to 3 seconds inhale, 3 seconds hold, 3 seconds exhale, and 3 seconds hold. And if this is too fast, you could slow it down again, 2 seconds, 2 seconds, 2 seconds. or just follow your breath as a calming mindful exercise. You might engage quiet music or aromatherapy, like lavender oils, if you're up to it. And 3 to 5 minutes a day, or when you're stressed, is enough to cut down on stress response in your body.
Absolutely. I've noticed that when I step into large spaces, I have to take some time to breathe before walking in and interacting with people. So those breathing techniques are phenomenal. Thank you, doctor. Here's one from Fred in Boston. During the pandemic, I actually was able to see some positives, such as more time with family, more time to cook healthy meals, and time to exercise. How do I hold on to these new positive habits once I return back to my busy schedule?
Yes, it was a gift of pandemic in a way, a lesson to lead simpler and slower lives. And not everybody wants to go back to the 9 to 5 jobs, and the employers now are adjusting on flex timing. And so that's a good lesson of the pandemic to again listen to your body and slow down, balance your lives, and hopefully we'll be able to adjust and continue leading this more balanced life.
Absolutely. You mentioned returning back to work, and we have this question from Mary about work. She says, what can we do throughout the work day to reduce anxiety and stress?
I can't emphasize enough that it's important to have 1 to 3 to 5 tools that you would use, remember to use when you're stressed out. Breath is one, slow conscious breath for 1 to 3 to 5 minutes, as much as you can. You could do it in the meeting, just, close your eyes for a second and center yourself and breathe slowly. Nobody will notice. Visualization of pleasant activities, your favorite place to be, like at the beach, for instance, or in the mountains. Just take a second, visualize yourself there, center, and respond from this centered and calm place. And that would be a tool for you to not get frazzled or stressed out throughout the day.
Great advice, doctor. I'm actually visualizing myself on an island right now, and it's really calming me down. Many folks are rightly worried about getting back to normal. I know I am. But if you're fully vaccinated, there's no reason to stay in quarantine. Let's take a moment to remember how much we love the summertime, y'all. Take a look at this. I love that video clip. It makes me crave that salt, fresh air. Okay, we've got a few more questions, doctor, to answer. Here's one from Theodore in Springfield, Missouri. Do you see any long-term impact from the pandemic on our mental health?
Unfortunately, I do. I direct a post-COVID clinic at UCLA where we take care of patients who had COVID and also anybody who had anxiety around COVID. Many are suffering from PTSD and newly acquired anxiety disorders, fears, phobias, depression of getting COVID or getting COVID again. Many are terrified of getting out of the house again. And so that's a mental condition that has to be dealt with. Many are suffering from the consequences of quarantine, like lost jobs, financial losses, and so forth, losses of loved ones. But the real toll is actually on those who had COVID, and about 30% of them developed new neuropsychiatric disorders like panic and PTSD, cognitive problems like brain fog. And that is due to changes associated with COVID virus. So we're working with them. It's important to reach out for professional help.
Absolutely. And we can't stress that enough. If you're noticing any of these signs, you have to reach out for that professional help. Thank you for that, doctor. This is what Suzanne from Shreveport is wondering right now. I've heard that anxiety can increase my risk for heart disease. What is the connection between anxiety and our heart health?
So anxiety is in a way as a chronic stress state associated with increased hormones of stress, inflammation, increased levels of glucose and lipids, blood pressure, heart rate, and that has a deleterious effect on cardiovascular system, but also on the brain with shrinking hippocampus that may lead to further problems with memory and Alzheimer's disease. So it's very important to address chronic stress, chronic anxiety with the tools that you have to select for yourself.
We have another one from Cyrus. This is what Cyrus is asking us today. I've been vaccinated, but with the lifting of restrictions, what advice can you give if I'm still not comfortable with removing my mask?
Be kind to yourself, and you can explain to whoever is challenging you that you're not comfortable and you're going at your own pace, and gradually remove the mask, especially when you're outside, maybe just pick on the beach, for instance, or in the woods, and then progress to less crowded places, and then progressing to indoors. We call it gradual exposure to the stressor. So you don't have to stress your body or your system. Do it gradually.
Absolutely. Absolutely. Our last question comes to us from Norma. This is Norma's question. How do I know when my anxiety is too much for me to handle on my own? Where do I go for help?
Yes, when anxiety becomes all-consuming, unmanageable, limiting your ability to function and enjoy life, it's time to ask for help from professionals, mental health practitioners, therapists, spiritual counselors, psychologists, marriage family counselors, social workers, and psychiatrists. You could ask for referral from your primary care physicians or look for professional organizations in your area.
Absolutely. Great advice, Doctor. Dr. Lavretsky, thank you for easing our minds about resuming, recovering, and reconnecting. Is there anything else that you'd like to add before leaving us today?
I would say the main thing is to replace fear and stress with joy and happiness. And you can choose activities of your choosing that invoke joy in you, surround you with positive people, and just as an exercise, spend a moment a day asking, expressing gratitude for what you have, and looking for joyous moments in a day, and then breathe. Breath is your best instrument to slow down breath and calm down blood pressure and heart rate. Just 3 to 5 minutes a day. Aromatherapy could help, massage, and activities like this, mind-body activities like yoga, tai chi, qigong, meditation are known for stress reduction. Thank you.
Oh my gosh, I love that. Let's find that joy and let's take a breath. Thank you so much, Doctor. We appreciate the great advice that you've provided for us today. Friends, that does it for our show today. You can find any of our previous shows at the AHA's House Calls YouTube playlist. As I said earlier in the show, try not to let your anxiety keep you from experiencing the things that you love with the people that you love. If you're fully vaccinated, you should be able to get your life back. And if you're not fully vaccinated, I have one question for you. Why not? Get your shot right now. It's free, it's readily available, and it's also your ticket to ride. Take care and take a look at this.
Getting back to this, to her, to family, to friends, to hugs. For people at higher risk of COVID-19 complications because of diabetes, high blood pressure, and heart conditions, the COVID-19 vaccine is an important choice. Consider it's the first step towards getting back to what you miss so much safely. Getting back to life. Set your heart on it. It's up to you. A message from the American Heart Association.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.